A very good evening to you. First tonight, the renewed concerns over the NHS's ability to recruit frontline staff in the capital after Brexit. It comes as new figures reveal the extent to which London hospital trusts depend on midwives from the EU. And NHS bosses tell us recruitment has plummeted since the referendum in 2016. The government says it's looking at a special visa scheme for healthcare workers. Here's our Brexit reporter, Mark Ashdown.
Welcome to the world, little Alfie. The latest Londoner born at North Middlesex Hospital's maternity unit. He'll be well cared for in his early days by a multicultural team of midwives, including Italian Antonella. She's got no plans to leave London, but some of her colleagues are not so sure.
Some mother have already started thinking to move back to their countries or find another place, because obviously this period of uncertainty is not ideal for some people.
NHS figures analysed by the Bureau of Investigative Journalism show just how reliant London's hospitals are on EU nationals. At 16 of them, at least 10% of midwives are from the EU. At 2 hospitals, the figure is 26%. Since the referendum, recruitment has plummeted. Last year, just 33 midwives arrived here from the EU, a drop of 88% on the previous year. And because it's such a stressful role, the Royal College of Midwives says the NHS has to hire 30 midwives just to increase overall headcount by 1.
Since the referendum, there has been a massive drop in applications from EU nationals to work as nurses and midwives in health and social care. It's not to overstate it to say that those applications have dropped like a stone.
We are here every day and every night of every year.
But the government is trying, as this recent recruitment ad shows. Ministers say they're looking at ways to prioritise and fast-track European NHS staff through the new visa process. The government say they are welcome, they are valued. Is that message not getting through?
I don't think it is, and I think the reason that it isn't is because of the tone we're having of the debate about immigration. It's so negative, it's so poisonous. We expect people to come here to work in our NHS, to make our NHS better, and yet the way we talk about immigrants is making these people feel as if this isn't somewhere they want to live.
Brexiteers want to see more UK midwives trained up. The Department of Health promises 3,000 more nationally by 2019. In London, it might not be that simple.
Throughout the UK there is a shortage of midwives nationally, so when we have experienced midwives, they'll generally get a job in a trust local to them where they're bringing up their family and they'll stay there. Central London rents are really high, so people will move out of the capital to those outskirts. It's very, very tough to recruit qualified, experienced midwives from the UK.
By the time Alfie grows up, things might be a bit clearer.
So Mark, concerns over the recruitment of midwives from the EU. You mentioned training up more people from here, but what about recruiting from other parts of the world?
Yes, well, that is one of the key Brexiteer arguments. Certainly countries like the Philippines, Sri Lanka, India, lots of staff there ready and willing to come over, we're told. Now, it's worth saying we already do that. We do recruit from further afield, but there are issues, certainly with that as a quick solution, which clearly appears to be needed. Now, training is the big one. We have very high standards here. It's kind of become accepted over the years that staff from within the EU, we accept their standards. They can just come here, hit the ground running, start working straight away. With other countries, it's a bit more complicated. It's not to say their training's not up to scratch, it's just they might have to provide more proof, jump through a few more hoops, do a bit of training just to adapt, as it were. So there's not a problem, it's just that training and recruitment takes time, months, maybe years. This is a crisis, some call it, which is unfolding now, and winter is coming. NHS is always under more pressure. The last thing they need is gaps. So I think the point is this government message that we're open, we're welcoming, we value EU staff, according to these figures, is not getting through.
Okay. Mark, thanks very much.